Welcome to All Things Autism by Court One, where we explore the many facets of autism support, awareness, and advocacy. My name is Manav Rawal, and I'm joined today by my co-host Niyati Kathuria. Today, we are excited to kick off season 2 of our series, which will highlight the various perspectives and outlooks on ASD within our community.
It's important for us to remember that the perception of autism is subjective and different for each individual. In episode 2 of our first season, we explored the diversity of the autism spectrum, highlighting that no two experiences are the same.
We are excited to feature and hear from Dr. Vivek Veluchamy today. Dr. Veluchamy is a board-certified pediatric neurologist who has been in practice for over 20 years. Recently, he opened up his own private practice in Canton, Ohio, serving as one of very few outpatient child neurologists in Ohio. Generally, pediatric neurologists are quite rare, with a current shortage in the United States. The Child Neurology Foundation quantified it to be at least 20% below the national need. Dr. Veluchamy, thank you for joining us today and congratulations on taking the big step of opening your own practice.
Thank you, Manav and Niyati. Thanks for having me on your podcast. I think there's an important topic to discuss, and I'm happy to share some light into it.
Let's dive right into today's episode. In our last episode of season 1, we discussed the importance of early intervention. I think it's pretty safe to say that you, Dr. Veluchamy, are quite involved in both the detection and intervention processes, both diagnosing the condition and referring to specialized intervention programs. So, broadly, how much can early detection and intervention influence development in autistic children?
So, Niyati, autism is very common. It's the incidence of autism has increased over the last few years, and 1 in 31 children in the U.S. is being diagnosed with autism. The American Academy of Pediatrics recommends developmental screening and particularly autism screening at age 18 months and 24 months at the pediatrician's office and to look for some markers and signs of autism. And there may be like early signs even before 18 months, like limited eye contact, not responding to their name, lack of pretend play in the child, and difficulty with the joint attention. Diagnosis should be considered reliable by the age too, but early screening does help.
That's a really detailed and informative answer, so thank you so much for that. We have identified that early detection and intervention are both very essential for the development path of individuals on the spectrum. So, going along with that idea of early detection, from a neurological standpoint, what are the earliest signs or brain-related markers that may indicate a child is on the autism spectrum?
From brain-related markers for autism, we have to look for different conditions. Autism is not just one condition. The different conditions can cause autism. Sometimes there are genetic markers. We have better genetic testing today than when I was in training. We're able to do like a whole exome sequencing. We can look at microdeletions or breaks in the chromosomes that are related with autism. We have been checking for Fragile X for a few decades, and those kids can have autism. There's a new test for looking at cerebral folate deficiency, where folic acid is unable to get inside the brain due to folate receptor antibodies. Back in the day, I used to do spinal taps on babies and children to look for folinic acid levels. Now there's also like a blood test available to look for like folic acid antibodies. And there are some interventions based on that. So the other tests, we usually do an EEG to see if there's epilepsy related or there are silent seizures. Some kids can have nocturnal seizures, and we also do MRIs. MRI can show any like misfolds in the brain, or if the brain is smooth, or there are like multiple folds in the brain. Those things can also lead to autism like picture and give a specific reason.
Yeah, and technology has definitely come a long way since the beginning of these diagnoses. But we just wanted to know how many of these diagnostic scanning techniques do you use every day in your practice, and could you tell us a little bit more about them?
Yeah, so from a technological point of view, we order MRIs. MRI neuroimaging has come a long way. Yeah, there is we also look at we can do like machine learning methods to look at behavioral data, brain scans, even eye tracking patterns that can be done. We use genetic testing and biomarker testing, which is very common to identify autism-related genetic variants. And sometimes we identify new variants that gets added to the list of conditions that can lead to autism spectrum disorder. Yeah, and in I think in the simpler terms, we use digital and telehealth to give access to remote patients who may not have a close access to a neurologist or a developmental pediatrician. So I think telehealth and digital health platforms have made it easy to access and get care and get screened if the parent looks into yeah, suspects autism-like features in their child.
Wow, that's fascinating. It's incredible to hear how technology is being used in neurology. So many parents nowadays are wondering if folic acid can be used to treat symptoms for those on the spectrum. So we were wondering your perspective based on your gathered experience.
Yeah, that's a very good question. It's one of the hottest topic in autism spectrum disorder these days. So there was a study in Belgium that looked into cerebral folate deficiency in children. They did spinal taps in a large number of like close to like 30 or 40 autistic spectrum children, and they found that a lot of them had cerebral folate deficiency. We all consume folic acid. Folic acid is actually put in the bread and a lot of the food, and we are able to consume it. But there are receptors in the brain that transport folic acid from the blood into the spinal fluid, which is inside the brain. So these kids may have antibodies against these receptors, and they're unable to transport the folic acid inside their brain. And folic acid is important for certain metabolisms for neurodevelopment. And these kids, there are tests now to do a blood test instead of a spinal fluid test, which would be ideal, but you don't want to take a whole number of kids and do spinal taps on them. But there's a test called FRAT test, FRAT, which is done by one company in Pennsylvania. In fact, I just ordered a couple this morning. And so it's a blood test looking for this antibody. And if it is positive, you can definitely supplement with leucovorin, which is vitamin B9. And unfortunately, there's a lot of misinformation that you can buy leucovorin or folinic acid from Amazon and supplement it, but that doesn't have enough quantity to help the child. So it has to be done under the supervision of a physician who understands this. And these children are fragile, so they need to be monitored and supervised. And I think I have treated some of these patients with leucovorin, and I've had some positive response. And so I think it's definitely hopeful, and we'll be testing more people who come to the office with this concern. Yeah.
That's a really awesome insight. And it's really important for the implementation of such supplements to achieve cooperation between the physician and the patient, whether it's the pediatrician or a specialist. Currently, many parents aren't particularly aware of folic acid's anatomic role, so this is a really helpful idea. So, are there any misconceptions that you currently see regarding the neurological aspects of autism that should be addressed?
Kids with autistic spectrum disorder have a wide range. Some of them have a very severe disability, and some of them are very high functioning children. Some of them are very talented. They just lack the social aspects of life. But so I think every patient should be looked at individually, and we should try to enhance their life to so that they can reach their full potential. And I think that should be the key role of a physician and society as a whole.
Yes, we've definitely seen a lot of examples of how much of a range the autism spectrum is because every individual has their own experience and their own needs. Um, it also means a range of abilities and a range of challenges. So, what would you consider the biggest barriers for detecting autism earlier?
Um, good question, Niyati. I think first of all, there could be a limited access to specialists. So that's why the American Academy of Pediatrics recommends do developmental screening and look for this particularly at 18 months and 24 months. And sometimes there can be inconsistent screening practices, and some physicians and providers may do like adopt a wait and see approach, or there's just speech delay, or there's atypical. Let's see you back. Sometimes there may be like insurance and financial barriers that we're not able to do the genetic testing. We're not able to get an MRI or get like a overnight EEG. There are also limitations in uh, tools like the ADOS, the Autism Diagnostic Observation Schedule Testing, which is a long test. It's expensive. There are limited folks who can do this, and sometimes the wait for that can be like 6 months to a year at places. So, um, and many screeners will rely on parent reports, which can be based on, which can be biased, and there can be cultural variations in how parents will report. They may think that, oh, my child is fine, I don't need help at this point. So there's also gender bias, like girls may be diagnosed later because compared to boys, and there's also there can be social stigma and misinformation in getting delay in treatment or diagnosis. So I would see that those are, there should be more better training for providers in early detection tools. And I think we should always have the insurance companies have better policies at the state level to ensure that insurance companies cover these services so that these children can get early intervention and appropriate therapies to have an improvement in their overall health and behavior.
Yeah, so I'm really glad that you mentioned the screening wait times. Particularly in rural areas, individuals are disadvantaged due to the current shortage of developmental pediatricians, creating something referred to as a service desert. Social stigma is also a major aspect for us to consider, leading to misinterpretations of behavior. Are there certain developmental milestones that, if missed, should raise concern for further evaluation?
The screening recommendations with the pediatricians are very important. We want to see even before 18 months. How's the child making eye contact? Is the child responding to your name? Is the child doing like patty cake or peekaboo with you, or just wants to play by himself or herself? So those would be important, and there's like we have to be the screening is important at like 9 months, 18 months, 24 months, 30 months. But you want to try to pick it up at least by 18 to 24 months. And if you have a positive screen, that should lead to a comprehensive evaluation. And that's where the barrier you mentioned, Manav, that the wait time, the access desert, for developmental pediatricians and behavior intervention specialists becomes a problem. And even if we refer to ADOS testing, it's a long wait to get to see I see routinely parents come in and say, oh, I have like an appointment in 2026. So, and not all children show signs early, some may be diagnosed a little later, and sometimes girls are diagnosed a little later than boys due to subtler symptoms. So I think we should keep a um, keep a close eye, and that's why the well visits with the pediatricians are very important, so that parents and the pediatrician can discuss these things, and the pediatricians will refer appropriately if they notice that there's some concern.
And honestly, I think it's really shocking that people have to wait so long just for a specific screening process because it's a really qualitative first step in the diagnosis process. But what else do you think are some specific benefits to early neurological detection other than screening, when compared to typical behavioral observations?
So, Niyati, I know you're shocked by the long wait time, but this is in the family's mind. This is like they go through this every day, and you can only imagine how frustrating it must be for a parent to pick up the phone, call somebody, and say, "Oh, you will see your child in a year." So, uh, to uh, to answer your next question, benefits of neurological intervention could be we can try to give the child like ABA therapy, have them intervene with speech therapists, teach the family how to work with the child. It's usually like a family-based intervention because the family has to participate and advocate for the child. And the key is to try to get the child to communicate. Otherwise, the child will become very frustrated. They'll develop more behavior problems because they're unable to communicate. And plus also do other testing like MRI, EEG if needed, and look for cerebral folate deficiency. If to add, I'm trying to add that to my practice as we speak. So the early intervention and early um, approach to some of these things will help a better outcome. We don't want to lose years trying to get there.
To this point, for both early detection and early intervention, we have been informed that a family centered approach is essential for children with ASD. As a pediatric neurologist, what would you identify as the ideal family centered approach?
So early, the family-centered approach is it's important for the therapist to involve the family and teach the family about some of these therapies so they can adapt it and implement it at home with the child. Um, so the family members are active participants in planning, implementing, and evaluating care, not just passive recipients. They just don't sit in the waiting room while the child gets therapy. You have to have the therapists, educators, medical providers, family all work together. And and then sometimes you have to respect the cultural values, parenting styles. Everybody is different. And so that incorporating that will help them participate better than one size fits all. And families will feel empowered that they're receiving training and resources to advocate for their child and help their child adapt because they're with them 24 hours. Um, and when families are involved and therapies are more consistent, they're tailored. Kids with autistic spectrum disorder like a routine, I would say. And the parents, when they're involved, they stick to that routine and they don't deviate from that. And that's really helpful for the child to adapt.
Yeah, so parents are definitely a significant part of this process, as you mentioned, and they can contribute their own personal beliefs and stigma to the process as well, especially in the early detection time. So
Yes.
at the same time, it's really good to know that parents have to foster a home environment with a stable routine, as that's
Yes.
what's most beneficial for their child on the spectrum. But what would you say as a physician to parents of patients who are hesitant to pursue an evaluation at a young age?
I can understand that there may be some fears for families to get their child evaluated, and there may be hesitant. And but I think uh, getting an early screening will help them diagnose if there's a problem early. They may do a screening and find out that there's no problem. Maybe there's just a little speech delay. And I see a lot of parents bring their child, and their first question is, "Does my child have autism?" And I look at them and evaluate them and say, "No, you don't. Your child does not have autism." So I would encourage families to ask the question to their pediatrician, or if they have any concerns, without hesitation. It's the communicating well with your pediatrician or your neurologist will help understand your child better. And remember, parents are the best advocate for their children. And some of these children are young and they can't speak for themselves. So I would encourage every parent who has some concern about their child to reach out and write down questions and ask their pediatrician or their healthcare provider.
Right, yeah. So generally, the entire care process, whether it's on the part of the family or the physician, is collaborative and it requires connection between individuals. So playing the part of the pediatric neurologist in this greater system, how do you integrate input from parents, pediatricians, and therapists in forming an early diagnosis?
Oh, that's a good question. Yeah, the key is to communicate with all the team members. This is a multidisciplinary approach, and we try to communicate. And I always aspire to do a better job communicating. And so we have to be, we have to communicate, try to help these kids. So we may have to have better protocols where if there's a child screened with autism, how do we, what kind of steps do we take to integrate them with the appropriate therapist, appropriate testing, and can we get them the right MRI, genetic diagnosis, and other blood tests at the right place? Can we have a place who from a phlebotomist who's a little trained in getting blood from autistic children? And so there are a lot of things that go into your mind that, okay, how do we help this family best so that they can get the appropriate care?
All right. Thank you, Dr. Veluchamy. Thank you for your thorough insights and contributions to the autism community, and thank you for providing us with the vital perspective of a pediatric neurologist. Remember, recognition, diagnosis, intervention, and education requires cooperation, collaboration, and understanding. So there are many perspectives involved.
Thank you, Manav and Niyati, for having me.
Stay tuned for the rest of season 2 to become familiar with these perspectives. But that's it for today's episode of All Things Autism by Court 1. If you would like an appointment with Dr. Veluchamy at Canton Child Neurology, do not hesitate to call his office at 330-288-7006 or visit www.cantonchildneurology.com.
For our listeners, until next time, take care.